Let me see. There was another gentleman with camera over here, sir. You've been waiting. And again, I'm going to do my best to get to everybody, so, even as the sun falls.
Thank you, sir. My name's Jeff Harris. I'm a resident here of town of Mendon. Surprisingly, there's been a total lack of candor in this whole debate from folks across the spectrum when it comes to the topic of quality of health care. It seems to me that the debate is focused tremendously on access. And what I'd like to know, sir, from your perspective, where do you stand on the topic of quality of health care? When you add 40 million new people to our health care system, what can you say about the quality of the care that the individuals that will be under that plan have? And when it comes to rationing, that's what I want to understand.
So, just to restate to make sure we all heard, can I make a comment about quality versus access and then a statement about rationing? I heard from over here that every American in the United States already has health care and can access health care. By the way, there is an element of truth in that, because they access it mostly when you're uninsured through the emergency room. Now, that is the least effective and most expensive manner of accessing health care. So part of the statement is what was just said. People are already accessing those services, just in the most inefficient, least effective, and most expensive way possible. There is a great deal of focus in this legislation. It's one thing I happen to like about it with respect to private health insurance and the training of frontline medical doctors. A shift away from large subsidies in specialties to training for internists, pediatricians, family practitioners. Those doctors who are the first to see the patients. That is by the way, that's very cost effective. If you can go to an internist and get diagnosed, instead of having to get so sick you have to go to a specialist or a family practitioner, or here's a thought, something that's happening in Chemung County, not too far down the road. They are staffing Medicaid day clinics, outpatient clinics, with nurse practitioners. Because nurse practitioners very cost effectively can see a lot of patients quickly, especially, for instance, if it's flu season. So quality of care is very important. And one of the problems I have is there's not enough detail. Now, you add more detail, then a lot of people start yelling about the fact that the bill is now 1,200 pages long because you're addressing some of those details. So you really get into a conundrum. The question of rationing. So I hope I'm being candid with you, because you said there's been a lack of candor. I'm known as being pretty candid.
Well,
let me answer the rationing piece first.
Sure.
If you ask 10 different people what healthcare rationing is, you'd get 10 different answers. To the person who just lost their job and no longer have health insurance, their health care is being rationed. If you ask somebody who is an executive who has a very, very high-end health care policy that costs $15,000 to $20,000 a year, and the corporation pays that to retain that highly skilled executive, and all of a sudden he loses $10,000 of that, he would say that's rationing. And I mention this because I've talked to a lot of people who've given me different thoughts on rationing. The reality is the ultimate rationing is over 40 million people who have no health insurance. I mean, that's the ultimate rationing. So bringing so many Americans over a period of time, and by the way, even if this bill passes, nothing happens for 4 years. Nothing. So the question was, so what's the hurry? Let me just restate. I'm the guy who fought to slow the process down. That's me. So I not only do I hear what you're saying, I heard it before you said it, which is why I took action on it, and that's why we're here today. Let me go to another question.